Welcome to this week's edition of Making Sense. I'm Gareth Edwards. Such an important month, as we all know, August is, but August is also coming to an end. And I'm sure you would have seen with all of the interviews that I did on ENCA and us here at ENCA the entire month, the biggest concern for me was that we only in inverted brackets, commas, talk about women issues in Women's Month. We should be talking about it all the time, but at least it does get attention 1 month of the year. And then, of course, you have National Women's Day as well. And the reason I bring this up is as we're getting to the end of the month, I had the most wonderful, wonderful guest with me on all angles. And I had to convince her to come through and spend some time with me on the podcast on Making Sense. It's a pleasure once again to welcome Matshidiso Lencoasa back to ENCA. And a fantastic title you got, by the way, because I'm going to say from Section 27, but that's not really the whole story because you are a budget analyst. What do you do?
Yeah. So first of all, thank you so much, Gareth, for the opportunity. So yes, I'm a budget analyst or public finance analyst, and I'm all about just advocating, advising, but really positioning South Africa's economy to serve its people. So every single rand of taxpayer money should actually translate into quality public services that truly build a nation. And so I'm interested in that. So sometimes I work alongside government, sometimes I'm fighting with government, depends on the hat that I'm wearing. So working alongside Parliament so that we can bring Parliament to the people through the Budget Justice Coalition, work with other civil society organizations, also with, sometimes advising National Treasury, but sometimes at odds with them if I'm through the Budget Justice Coalition, and then also advising them through Imali Yetu and Fiscal Openness Accelerator. So all of that, just really trying to make sure that every single rand actually translates into a better life for all.
Do you see why I let TD do it? Because I can't do that introduction the way you did. It's wonderful work that you do. Now, the angle that you come from, especially in Women's Month, is what I find so fascinating because you talk about the issues with Treasury, you talk about the issues with budgeting, you talk about the issues of policy implementation when it comes to women, and when we lack all of that proper oversight, how it impacts women and young girls. And we can talk about GBVF, we can talk about healthcare, we can talk about education. All of those issues actually stem from exactly the research you do. So I'd like to start here, if we can, from the health clinic perspective. But that's a lovely analogy that you give. The local health clinic, when that isn't getting the finances it needs from provincial government et al., what impact does it have on women?
So over the past decade, we've seen really, especially post-COVID, we've seen a defunding and disinvestment in our public health system. And I think that a lot of people will be surprised because we hear allegations of 2 billion rand stolen from Tembisa Hospital, for example. So we can hear billions that should be going towards public services. And so we clearly have a problem with quality, but we also have a problem with quantum because we have an economy that is failing to grow at the rate that it should, and it's not creating jobs for the masses of our people. And so what that means is that most people just cannot afford public health delivery outside of the public, healthcare outside of the public health system. And so more and more people are using the public health system and needing it. And yet our investment in it is either stagnant or is we're disinvesting as a country. And so, the reason for this is also because we are spending so much money servicing our debt. But as a country, we're not really building new clinics. We're not building new hospitals. And so we really do ask what all of this debt, international debt, but what do we have to show for it? And it affects everyone. But as we know, most nurses, most community healthcare workers, when you go to a local clinic, it's mostly women who do the care work in our country. And yet when it comes to the budgets, around should we allocate more, should we allocate to which programs there are, there's very little communication to the people who are affected by it. And so we're really just calling for a government, trying to build a caring state. And I know it sounds like a fantasy because we're just so used to a status quo. But it should be
a reality, though. It shouldn't, because it's taxpayers' money.
Exactly.
This is exactly what it's meant to be allocated for. And it's on that allocation where, to the point of the healthcare clinic in this case, yes, often women there caring for the young, the elderly, the sick, or whatever it might be. The other problem I picked up with the research and the work that you do is health clinics are meant to be places of safety. It's often the first time where signs of violence, trauma, sexual abuse are picked up by healthcare workers. But if those facilities don't have the staffing, they don't have the expertise, if they're so run down, local community and women won't go there, that causes a problem down the line for GBVF because there's now nowhere safe to go. It's that, and that's why I love the way you link all this so nicely. Just tell me about how that link came together.
Yeah, I think that's also a very important perspective. So very much inspired by engagements that we've had across with communities across the country, particularly again through the Budget Justice Coalition. We were in Monkey in the Northern Cape, which is a far-flung village, and people there explained, and women there would tell us that there is one clinic that services around 200 of the villages around there. And that clinic actually just has stopped working because there was only one nurse, and that nurse just either retired or passed away, I'm not sure, in 2021. So since then, they don't have access to a clinic. And so what that means is in our society, it is mostly, we need each other, men and women, but it is mostly women who take sick children or relatives to clinics. And so those women in those communities...
More sympathetic, more empathetic. I think everyone can agree with that.
Yes. And so in those communities, they then can't go to their local clinic. So they have to find, and the Northern Cape is so sprawling and it's so huge. And so everything is so far from each other. And so the little money that maybe is going towards that is allocated for child support grants or that they receive, be it through a SASSA grant, ends up going towards the transport costs just to get public healthcare that works.
And the concern then is, because it's so far away, diseases aren't being treated. I'm thinking of young women in poverty, and I know this is work that Section 27 has done before, where you're finding young women, young girls are getting into relationships with older men simply for financial support. And I know there's an ethical debate about that, and I understand that. But because they're not getting the care they need at these clinics because of their poverty situation, it does lead to the societal issue where they are being preyed upon by men in some cases, aren't they? Yeah,
that's also a really important point. And I think you mentioned it, that a lot of civil society organizations have done work on sexploitation as an example. And so while public healthcare, it's not that government is doing the people a favor. We are paying for it in our taxes, whether you are working, if you're fortunate enough to have a job in this economy, you're paying income tax. But if not, you're paying tax every time you pay VAT, or, you buy food, or you take a taxi, and, that taxi fare that goes towards a fuel levy. And yet when women, especially, thinking about the safety of women. So on two fronts, if you have experienced gender-based violence, you get to a clinic that's under-resourced, and there's only one nurse who's overwhelmed and maybe cannot identify the signs that you need help in the same way. That does have an effect on the quality of health, and the quality of care and the response that the state gives. And I think also, to bring it back to the conversation around desperation, is that in this economy, because of the hardship, the economic hardships that people are facing, that they are, people are quite desperate and may find themselves in situations where they are doing things that they wouldn't ordinarily do just to feed themselves, but even just to access quality healthcare, which is a constitutionally protected right.
The issue of GBVF, we know it's been an issue for obviously far too long now, and Women's Month, it always gets the focus it should. And I'll say it again, like I said at the beginning, it should be getting this focus all year round, of course. But I'm a little confused, and help me understand this. GBVF being classified as a national disaster. Now, when something gets declared a national disaster, there's a series of steps which automatically kick in across various sectors. One of them, in this case, is budgeting and funding to tackle this pandemic. So it's being declared a national disaster, or a national disaster. But the money hasn't come out, not that I'm aware of. And if it has, where is it?
Yeah, exactly. And I think we've noticed, because we've had a few declarations of disasters over the past few years since COVID, where it gets the headlines. There are headlines around it's a disaster, but what does that mean for the lived reality of women, or people who are affected later on? And so I think the budgeting aspect, I think, is a really important one, because last year, when it was declared or classified as a national disaster, all eyes were on South Africa. It was the G20, and everyone wanted to not just hear that commitment, but to see that translate into practice after that. And so the rest of the world has come and gone, and they've moved on. We've moved on from the G20. We don't talk about it, and yet every day people in this country, women in this country, have to continue to live with what is considered a disaster. The budget at the beginning of the year didn't really allocate new money towards it. So budgets towards healthcare, towards social development is largely stagnant. And so really provinces and departments are supposed to use their existing money to help to address this. But if it's a disaster, then surely we're saying that the current response and the scale is not enough for what women need. And so we really should be investing a lot more, and we haven't done so.
We haven't done that. No, it's I'm trying to remember an old argument from years ago. It's recognition without response,
Exactly.
which is nothing. Actually, it doesn't change anything, which is just my next point then. I know you look into a lot of policy frameworks and policies and implementation of policies. Why are we so bad at implementing a policy like this? Well, the money is supposed to be there. It was declared a national disaster. There's obviously the intention, but we can't seem to nail a policy on this. Why? Where do you think the hiccup is?
Yeah, I mean, budget, obviously as a budget analyst, I'm biased towards that. Not just how much money, but also how that money is used is one of the problems. So we have these wonderful policies in this country. Yes, they could always be better, and they should always be better, and we should always be strengthening them. But they often are set up to fail when we're not investing in those policies. So it could be that we're not investing enough money that is supposed to address some of these problems, and that results in gender-based violence shelters that are being shut down, or NPOs that are giving this care that are also closing down because of funding constraints, let alone the healthcare system and among others. So we have these policies, but we're not funding them. So the quantum of our spend is just setting them up to fail. We can't hire more nurses. We can't hire more community health workers and really just deliver better quality services for our people. The other problem also is that of that little money that is allocated, we see that much of it is actually not spent where it should be spent. Yes. So we have issues with underspending. So the Department of Health in provinces is quite notorious, even well-funded provinces like Gauteng, for returning money back to National Treasury that they couldn't spend. But that doesn't necessarily mean the need is not there, because we all know that we do need these services. And so it does double punish the people who need the patients, because they don't get quality services, and they're not the ones who underspend, and yet they get punished for not getting quality services. And then, of course, with the Madlanga Commission being top of everyone's mind, I think there's also a reflection that a lot of that money is actually is irregularly spent, or there's a lot of wasteful expenditure that doesn't translate into a better life for people in our country. And so we really need to address those bottlenecks and have better consequence management and accountability as a country. I think we're yearning for accountability for our tax money.
Yeah, it's the same argument, I think, when it comes to the water situation.
Yes.
There is arguably enough water. The problem is our water infrastructure is letting us down. Their water is there. It's almost, in this case, the money is there. It's just being allocated incorrectly, or not being allocated at all. Like the taps for the money isn't being turned on. A closing tradition on the podcast is, I always like to ask, what have I not asked you that we should be talking about? Because you are the expert. I'm the muggle in this case. What would you like to leave people with at the end of Women's Month?
Sure. I might have a little controversial take here, but I often see these conversations around women's empowerment or women's rights as being positioned as men versus women, or us versus them. And, advocating for marginalized women especially doesn't mean that we are against men, or the boy left behind, or the men that are silenced. I think it's more about that we need each other. But in order for us to be empowered as a nation, we also need to address that we experience our society in different ways. I know, for example, with healthcare, men are not getting, TB is so prevalent among men particularly, because they're not accessing healthcare in the same way. And in the same way that we're passionate about gender-based violence and addressing that, we also want men to also have access or get the access to healthcare that they need, because of course it does affect, the TB will then spread to women as well. So we need each other. And so I think that something that I would leave behind for people is maybe to move away from us versus them. Not that we're doing it in this podcast, but I've just noticed some of the reflections, and maybe it came from anger, whatever activism, but that we really need to empower each other so that we can build a South Africa that works for all. And in doing so, we are highlighting and shining a light on some of the, women who are marginalized, who don't have a voice in this case around gender-based violence, so that we can really just address the the genuine issues that society is facing, so that we can build a South Africa that is safe for all of us.
And I truly, truly hope that when you and I sit down this time next year, again, either on ENCA or here on Making Sense, some of what you've said will have changed. Perhaps new budgeting, perhaps more implementation, because a year is a long time, and there's really no excuse that a lot of what you are saying here can't be implemented at all. I really appreciate you coming in. I've thoroughly enjoyed talking to you both here on the podcast and on ENCA. Matshidiso Lencoasa, budget analyst at Section 27. But as you heard, there's a much longer title, which I'm sure doesn't fit in a business card, but lovely to have you with us as well. And the point is, as we get to the end of Women's Month, we mustn't forget, it is not just a calendar date. It is not just a month that you stick on the fridge, that you then tear off the page and you forget about the issues of women in South Africa. There is a need for it every single month of the year, every single day of the month as well. I hope it's made sense. I'd love to get your comments down below. As always, you agree, disagree, it's your show as well. So you let us know. Thank you very much. And I hope that made sense.